Oh my God, get started. Good afternoon and good morning, actually, I should say, to everyone. I want to welcome you to another webinar Wednesday with the Temecula Valley Chamber of Commerce. Our Wednesday webinar series is dedicated to providing tools, education, and information that are of value to our business community and to our local residents. As a quick matter of housekeeping, I'd like to remind our participants that today's webinar only allows our presenters and our panelists to appear on the screen. Our audience is out of view and will not have the ability to be seen or heard. However, we invite you to use the Q&A box to submit questions throughout the webinar. Today's webinar is very special and very important. We'll be discussing a subject matter that all of us have a personal connection with. Today, we dedicate our time to discussing mental and behavioral health matters with some of our community experts. Joining us today is an esteemed panel of physicians and behavioral mental health experts from the Loma Linda University Medical Center. Please join me in welcoming Dr. Zach. So sorry, everyone. I'm having some technical difficulties. I apologize. That's just the age we live in today. But let me go back and give a quick introduction again to our topic, mental and behavioral health matters, with some of our community experts. I do want to give a warm welcome and introduce our esteemed panel. Today, joining us from Loma Linda University Medical Center, we have Dr. Zachary Hirschfeld, Medical Director of Adult Partial and IOP Program in Murrieta. We have Mr. Stephen Graves, Program Manager for Adult Partial Hospitalization at Loma Linda Behavioral Medicine Center. We have Mr. Glenn Scott, Director of the Youth Partial Hospital Program in both Murrieta and Redlands. And we have Miss Lorraine Baylor, the lead clinician for Youth Outpatient Program in Murrieta. I want to thank all of you for joining us today. And to get started, Mr. Graves is going to give us a quick presentation, and then we'll get into some moderated Q&A after that. So Mr. Graves, the floor is yours.
All right, good morning, everybody. Thank you for allowing us to spend some time with you today. Give me 1 second and I will share my screen. There we go. So the first slide is a picture of the BMC in Redlands, the Behavioral Medicine Center in Redlands. That's our beautiful Behavioral Medicine Center, right behind our beautiful hospital in Murrieta. Our office is actually located right behind the hospital in the professional office building. So a little bit of the history of the Behavioral Medicine Center. We have 25 years of experience in behavioral medicine. We started in Redlands. Redlands treats disorders such as eating disorders, depression and anxiety disorders, dual diagnosis, which is usually a mental health and a substance use issue, chemical dependency, pain management and detoxification, severe persistent mental illness. Redlands has facilities for inpatient hospitalization, partial hospitalization, and intensive outpatient services. Redlands also has the child and adolescent services. Again, it treats dual diagnosis. There's mental health tracks for both children aged up to age 12 and adolescents 13 to 17. Services for children and adolescents include inpatient, partial hospitalization, and intensive outpatient programs. So the BMC in Murrieta, the Behavioral Medicine Center in Murrieta, started back with adults in 2012. So we've been in the community for about 8.5 years already. Went by so quickly. We have a multidisciplinary team, and our medical director, Dr. Hirschfeld. Our partial hospitalization program runs Monday through Friday from 9 a.m. to 3 p.m. And our intensive outpatient program, IOP, runs Monday through Friday from 10 a.m. to 2 p.m. A little bit about our team. So our clinical team, again, includes Dr. Hirschfeld. He is our medical director. I'm Stephen. I'm the program manager. We have licensed registered nurses. We have a licensed psychologist. We have licensed marriage and family therapists, licensed social workers, and licensed professional clinical counselors. In addition, we have an associate marriage and family therapist and an associate master of social work. An associate is pre-licensed, so they're in the process now of collecting I think it's 2,000 hours of experience with patients before they can sit for their final exam. And then we have the clinical and administrative staff. So what's the difference? I've thrown the terms around a couple of times: partial hospitalization, intensive outpatient. So how I like to conceptualize it is, most people are familiar with like inpatient hospitalization for mental health. So that's where you go when you stay at the hospital for 72 hours or longer or shorter. Then we have partial hospitalization and intensive outpatient. And then right below that, we have our traditional mental health providers. So you might see a psychiatrist once a month. You might see a therapist every other week. So the partial hospitalization program acts as kind of a step between the two. So if somebody isn't quite severe enough for inpatient care, or if they need more attention than once a month or twice a month, they can come to our program, starting off in the PHP program. That involves continuous monitoring by a psychiatrist and daily treatment, which includes group therapy, individual therapy, and family sessions. Patients learn coping skills and ways to better manage emotions. Our treatment modalities are integrative, and they include DBT, which is dialectical behavior therapy, CBT, which a lot of people are familiar with, cognitive behavioral therapy, mindfulness, interpersonal skills, and relapse prevention. Our intensive outpatient, after 5 to 10 days of care, the patient steps down to what we call IOP level of care. They continue to see the doctor weekly. The patients then leave before we discharge them with an outpatient psychiatrist and therapist. So when they start in my program, they'll be with us 5 days a week. And that usually lasts between like 5 and 10 days or so. After that, we step down to the 10 a.m. to 2 p.m. IOP program. After a couple of weeks of that, we go down to maybe 3 days a week of IOP, and after that's graduation. Adult services. So how we treat patients is every patient is assigned to a track, what we call a track, and each of my therapists is responsible for one track. So my insight track treats disorders like depression, anxiety, and some BPD, by borderline personality disorder. Our Serenity track, again, treats our dual diagnosis, a mental health issue along with a substance abuse issue. Our Discovery track treats bipolar disorder, PTSD, and other mental health diagnoses. And then finally, our Focus track works with patients struggling with schizophrenia, maybe auditory hallucinations, or some sort of severe persistent mental illness. So I spoke a second ago about the modalities. So we use evidence-based practices, cognitive behavioral therapy, which I mentioned, dialectical behavior therapy. That's been around since the 80s, and it was originally developed to treat women diagnosed with borderline personality disorder. Dr. Marsha Linehan, who put the program together, actually struggled with that disorder herself. So she put that together, and what we found since then is it's a great treatment for lots of different disorders. So each of my tracks right now uses some DBT in it. Process groups, so that's kind of group therapy, how we conceptualize group therapy, where people are sitting in a circle and talking with a therapist. We have psychoeducational groups, individual therapy, and we offer family therapy. Let me go over the timeline. So from the time we get a call to schedule an assessment, and we can get that call from a therapist in the community, a psychiatrist, a doctor, a teacher, just somebody in the community, a family member, anyone can refer somebody to us. We schedule an appointment for an assessment, and we schedule that appointment within 48 hours of the first call. The prospective patient comes to the assessment, and it lasts for about 2 hours, 1 to 2 hours. And they first meet with one of our trained nurses, and the nurse gathers all sorts of information about the history of the problem the patient's had, about the patient's family, about possible history of mental illness in the family. After that, the patient's scheduled to start. And again, we start within 72 hours of the assessment. The nurse meets with Dr. Hertzfeld, and we talk about which track would be most appropriate for that patient. And then they come to us, and as I said a second ago, duration of services lasts between 8 and 12 weeks or a little bit longer. So factors that might send somebody to us or might get a referral to us: substance use, and that now also includes marijuana use, some sort of life crisis, a family crisis, domestic violence. Right now with COVID and how everybody's trying to adjust to being physically distant but still trying to stay socially connected, there's social stressors that are happening right now. People aren't working, and that can create more stress. Trauma, so either recent trauma or delayed onset of symptoms. Chronic mental health issues, personality disorders, maladaptive functioning, so just things just aren't going right now. And then finally, emotional dysregulation. The things that we try to help patients with are things like distress tolerance, self-efficacy, so regaining that sense that I have some say-so in my life, I control some of my life, interpersonal effectiveness, especially now, again, with the social stressors going on. Chances are when a patient comes to us, they're experiencing some sort of stress in a relationship. That could be a spouse, it could be a child, it can be a supervisor, it could be coworkers. Emotional regulation, so our emotions just get so big, I can't manage them. Mindfulness is a way to help with the emotional regulation and the distress tolerance. And so you would use mindfulness to, if you're suffering from anxiety, you can use mindfulness as a tool to help reduce your anxiety. And mindfulness also helps us improve our focus and concentration. Relapse prevention, that could be from substances, or it can be from relapse prevention so that we don't have another mental health crisis. Managing symptoms, Dr. Hertzfeld and our nurses provide medication management. And then finally, spirituality. Loma Linda is a faith-based institution, but we accept people of all faiths. So when I talk with patients or I talk with someone in the community, spirituality can mean my relationship with God. It can be my relationship with nature. It can be my relationship with the universe. And I'm going to turn it over now to Glenn Scott, who's our director for the Youth Hospitalization Program.
Thanks so much, Stephen. I'll let you drive this for me if
absolutely,
if you can. So
Absolutely.
Glad to be with all of you today. My name is Glenn. I'm director of the Youth Partial Hospital Program, both here in Redlands and also in Murrieta. And as we're going through, our treatment team is quite extensive. We have several psychiatrists that work with us both here in the Redlands and also in Murrieta. Specifically to Murrieta, we have Dr. Jamie Snyder, Dr. Hertzfeld, and Dr. Shahal. And then we have a multitude of clinical therapists and staff that help us in Murrieta. We have therapists, licensed therapists, and also associate therapists as well who are waiting to get their hours, as Stephen mentioned earlier. So similar to the adults, we have the intensive outpatient program that happens 3 days a week currently right now, Mondays, Tuesdays, and Thursdays from 3:30 in the afternoon to 6:30 at night. What's really, really cool about this program is the families are involved 3 nights out of the week. So for the first hour and a half, the young people are with their therapist. And then for the last hour, we have the multifamily group for our patients with the intensive outpatient program. We currently have 4 tracks down in Murrieta and looking to expand out to 1 more here in the next few weeks. And so the biggest pieces of what we're working on is helping the young people to work through some of the difficulties that they're experiencing with school, with family, with their social environment, and then bringing the parents along the way to help work as a family unit to overcome those challenges. The intensive outpatient program runs about 6 to 8 weeks, give or take a little more or a little less. And soon, very soon, we're starting our partial program, which will be in the daytime, but currently that program is only in Redlands, and that as was mentioned earlier, is a step down from the inpatient unit and in between stepping down to the intensive outpatient program. And so out of the 4 tracks that we have in Murrieta, we have 3 that deal strictly with mental health, and one of the tracks deals with dual diagnosis, which is a combination of substance use and mental health. So here are some of the reasons why a young person would come to see us. It does say children's services, but children and adolescents have similar difficulties. And so family conflicts, aggression, trauma, poor self-image, rage issues, difficulty with grief and loss, depression, anxiety are all some of the factors that would constitute someone coming and needing intensive outpatient services. We'll skip over this because we don't have these down in Murrieta, but in Redlands, we do have the Child Intensive Outpatient Program, and that's working with children as young as 8 all the way up until 13. And we have specialized programming for ADHD specifically with our Flex program, which has been really, really helpful and successful. We're rolling that out soon in Murrieta, but in the moment, those services are just located in our Redlands campus. The SHIELD program is specific to working with young people that have difficulty with self-injury and emotional dysregulation, specifically using DBT as the treatment modality for that program. We are getting ready to open up a specific DBT track down in Murrieta to add to the mental health and the dual diagnosis that we currently are experiencing. So as I mentioned earlier, children and adolescents have similar difficulties. One of the 2 things or differences that you will notice in this slide compared to the children's one, the self-harm and the runaway episodes, we see that a little more in adolescents, the identity and legal problems a little more in adolescents, but some of those factors are the same between the 2. So the mental health and substance use programs, as we mentioned earlier, we do have a separation between those. So some of our young people are just dealing with anxiety and depression, and so we have mental health tracks for that. Some of our young people are dealing with substance use and mental health, and so we're able to have programming for them. And then we have adolescents who are just struggling with self-injury and self-destructive behaviors, and so we have a program specific for those individuals. So we try to really work on individualized care and not just putting everybody into one group. So once that assessment is done, very similar to what was explained before, we're able to then decide based on the symptoms that you are presenting, which one of our programs would best serve your needs. So one of the cool things about our program, I think that I'm really, really proud of, everything we do is in a team. And so between the psychiatrists, nurses, therapists, and teachers, we all kind of come together and look at the cases and say, hey, what is the best way that we can help this patient? And then the family work through some of the challenges that they're having. The other cool thing that we have is we have multiple disciplinary teams that work with us. So we have psychiatry, psychology, nursing, social work, marriage and family therapy, and professional counseling. And each one of those disciplines give a different lens into the treatment that we provide. So we're able to kind of pull from all different sectors to make sure that we're giving you well-rounded and whole person care. Some other cool highlights that we have that we're really strong and proud of is we do have a strong community relationships. We go out to schools, we go out to churches, we do a lot of presentations similar to what we're doing today, just to work with the community and to let them know that mental health is just as serious as physical health. Sometimes I can see a broken leg, I can see a cut that I have on my skin, but I can't see a broken heart or a troubled mind. And so we really are really passionate about going out and breaking down some of those barriers that are out there when it comes to mental health, so that those individuals in the community can know that there is healing that is possible when we all come together. We work with your diet. We encourage you to exercise while you're in here because those release great endorphins. Spirituality is a part of that, meeting you where you are and helping you get to where you want to be. We offer quarterly brunches with this lovely COVID environment that we're in. We're doing everything via Zoom. All of our groups are telehealth. The therapists miss the patients coming in, but we are still available to go out and provide some education. We do provide CU and CME events that are very, very helpful. And then the parenting classes is really a key part of our programming as well. Parenting is not an easy job. I wish I could tell my parents that oh, did I lose? Hopefully I didn't lose you there. Sometimes I wish I could tell parents that there's a magical book that they can read. Chapter 15, paragraph 5. Read that and call me in the morning and everything will be okay. It doesn't work like that. So we really try to encourage and strengthen our parents, let them know that this is a difficult time, and there are some helpful tools that we can share with you to help you and your family move from where you are now to a place of health. We have very low readmission rates. What this means is that if you're able to successfully go through both levels of care, our partial and IOP, then the likelihood of you going or needing inpatient stay after our services is very low. We have high satisfaction scores, 80% or better for the families that come to see us. They do appreciate and love the services that they've been provided, and so they are really high on our satisfaction scores. And we do have a lot of patients that we see on a regular basis. Last night, between both campuses, we saw about 60 families in our IOP programming. And so between 50 and 80 families we serve daily, which translates to over 15,000 patient visits a year. So there is a great need for our services, and we are trying to fill that need as best as we possibly can. We recently had an expansion in the Murrieta area. This is our new McMillan Family Foundation outpatient clinic. And so we have a great new space where we can see an increase of patients, both in our partial and intensive outpatient programming. And brand new is our true outpatient services, where you can come and receive one-on-one therapy after you successfully graduate from our partial program and our intensive outpatient program. You can then continue services with us on an individual basis in our new expanded area. Thanks to the McMillan family and their donation. That brings us to the end of our conversation. I know you probably have lots of questions, and so we definitely want to open that up so that we can answer as many questions as you possibly can. And we definitely just want to thank you for the time of you sharing with us today, so we can help move mental health in the best direction possible.
Thank you, Mr. Scott and Mr. Graves. Excellent presentation. It's actually almost mind-blowing to see the number of resources that we have in our backyard. And, you know, I'll tell you, speaking as a resident of the community, it's sometimes overwhelming and very difficult to even understand where would I find these resources and really what exists. So we do have some questions that have come in. I'm going to ask and share them with you. So my first question, really, I'm going to maybe direct to you, Dr. Hertzfeldt, as a physician. Our community is very curious to know, what are some of the most common mental and behavioral health issues that you're seeing treated right now? And I think there's this curiosity in terms of, like, are we seeing a difference because of COVID and quarantine? And what are you observing?
Yeah, I can't necessarily say that I've seen an uptick in a certain, amount of disorders. The ones that tend to be most common are the depressive and anxiety disorders. They're across the board, some of the more common disorders that are present. I mean, if anything, we've seen probably more of a decrease in people seeking care for whatever reason, despite, the isolation that people have been having. So, if I could get maybe an overall picture, probably more the isolation with the pandemic and everything like that is probably contributing more towards depressive symptoms. But, curiously, it seems like people aren't reaching out with that to get treatment and things like that, which has been a little bit surprising, realistically, given that theoretically people have more time on their hands with a lot of things being closed and not being able to interact with people as much. So I mean, certainly, you know, our resources are available, and we would like to be treating more people, because this is an incredibly difficult time for everybody.
Yeah, you know, let's expand on that for a second, because I recently heard another statistic that was relative to child abuse reporting. The schools and teachers are typically a primary source for reporting instances of child abuse. And in LA County, apparently there's a 50% decline in the number of reports. And so the reality is that child abuse is probably not down by 50%. It's just our ability to connect with the source of the issues. And I wonder and suspect if, you know, with COVID happening, there's been so much concern about leaving our homes or intermingling too much, that perhaps some of that barrier is, gosh, is it safe for me to go to see a counselor or to go get help? What should our audience know about how they can engage with you? Can they do like Zoom meetings? Is it safe to come into the hospital or clinic setting? Help them understand.
I'll start off just real quickly. Right now, due to the pandemic, everything, all the services that we provide on the youth side are 100% telehealth. And so everything that we do, from the assessment all the way to treatment, is being done via Zoom. And depending on how the flu season goes, we'll extend it. We've been telehealth officially since March the 25th of this year, and we're on the youth side, we're slated out to at least January before we will actually bring patients in. But one of the things that we're finding is an increase in the attendance and success rate of the families. The therapists want the patients back in because it's a different dynamic, but the families are really enjoying being able to access services from their home. And as long as there's an adult there while treatment is going on, they're able to receive services in the comfort of their home. So COVID is not a barrier for them to receive services. No, we're not seeing you in person, but we still are able to help you overcome some of the challenges that you're having with the technology that is presented.
Well, thank you for sharing that.
Then on the adult side, if I can jump in with Glenn for just a second, we actually have a hybrid. So I mentioned I had 4 tracks. 2 of my tracks meet virtually using Zoom. The other 2 tracks are meeting in person, traditional therapy. That gives us the ability to accommodate patients and their individual needs. And so if somebody maybe is struggling a little bit more or having a more severe depression, we can see them in person 5 days a week. So.
That's excellent. I think that's an important clarification for our community to be aware of. And Mr. Scott, you had said that, you know, COVID is not a barrier to the help and the resources. And it's great to know that through both of your programs, there are options, whether that's in person, a hybrid, or a Zoom. The help remains the same. The resources are steadfast. We've got a question that's come in, and it's relative to health insurance. And I think, again, being just the average person, we don't know where to begin. Are these types of services and supportive services covered by insurance? Do we start with a primary care physician and find our way to you? How does that work?
We take all insurances. On the youth side, there isn't an insurance that we don't take. IHP, Kaiser, MHN, Cigna, Aetna, Blue Cross, Blue Shield, the list goes on and on. And so we have a really great system. When you call in and wanting to have services, we have the ability to run your benefits to see what you are covered for. And we give that information up to you first. And so the assessments on both adult side and youth side are free. And so there's no charge for being assessed. We do that free of charge. And during that process, we'll be able to let you know, hey, this is your insurance does meet, and here's what your copay is. So we give that information to you up front so that there are no surprises. And the other cool thing that we were able to do, we just did it down in San Diego with Sharp. If there's insurance that we don't take, we can work a single case agreement. And so that simply means that if there's not a benefit that you currently have, there's a potential for us to reach out and get a single case agreement so that you can receive services. So we do everything that we possibly can to help. There is some scholarship funds that are available, not a whole lot, but if there's those willing to help us with that, we'll definitely take donations to help with our scholarship fund. But there are some donors who work with us and in our philanthropy department to make donations for individuals who don't have any insurance that need some coverage. So those are some options as well. So we'll take care a look at that, all of that up front. So that's not a stress. It's stress enough getting to us and finding the services. So we try to relieve as many barriers as we possibly can to get you the help that you need.
You know, I honestly think that could be a game changer for some people to know that they can first call in and get a free assessment and really get comfortable with your organization and maybe getting affirmation of what they're experiencing. And then they can literally provide you with their health insurance information, and you guys will do the work in determining, you know, what's possible, and you can lead them through the next step.
Yes.
Because again, I as the average layperson, I wouldn't have thought it would be that easy. And that right there would have been a barrier for me. I would have thought, oh, I have to call my PCP, and then I'm going to have to, you know, see if my insurance will cover it. This is amazing. And I love the scholarship option, and certainly we'll be mindful of who some of our bigger corporate sponsors might be to direct some funds there. This is definitely worthwhile. Mr. Graves, I'm going to direct this question to you, and you can feel free to share this with your colleagues, but our audience today is made up of individuals who, for the most part, we don't work in healthcare, and we all have varying degrees of experience with the topics of behavioral and mental health. And over the recent years, and probably more so in recent months, the terminology behavioral and mental health has become more regular and practical for all of us. But there are sometimes, I think, still stigmas associated with these words and treatment. So I'm wondering, how would you encourage our community, the average person, to view and define behavioral and mental health?
Well, I think right now we kind of use those terms interchangeably. And so, for instance, we're the Behavioral Medicine Center, the BMC. So we really pretty much use those terms interchangeably. Glenn or Dr. Hirschfeld, your thoughts on that?
I same sentiments. Behavioral health and mental health are interchangeable because your emotions kind of govern everything that you do. Your behaviors and how all of that is intertwined. Then behavioral health, mental health, there's no difference between the two. I think sometimes behavioral health helps to ease some of the stigmas that may be there. I may not want to say that I have a mental health issue, but I can say I have a behavioral health issue. And so even with some of the ways in which we engage, we're the Behavioral Medicine Center. And so, my young people say, Glenn, I went to a psych hospital. I said, you didn't go to the psych hospital. You went to the Behavioral Medicine Center. That's the name of my badge. So I'm not sure where you went, but this is the BMC. And so, kind of just helping to ease some of those barriers that come up. Behavioral health is probably where I would lean more so than on the mental health, but they work intertwined together.
You wouldn't be embarrassed or keep a secret if you had joint pain, right? You wouldn't be embarrassed or keep it a secret if you broke an arm. You wouldn't be embarrassed if you had high blood pressure. But for some reason, when our brain is broken, everybody's embarrassed or nobody wants to talk about it. And I think if we can conceptualize it like we would any other organ in our body, a lot of the stigma would start to decrease.
I think those are very powerful words of wisdom, and I hope that our audience really takes that perspective. In recent years, we've seen so much focus on fitness and diet and in other aspects of our health, but we haven't as openly talked about just how our mind and our soul are doing. And they're really the lifeline of everything. So you guys are incredible for helping us nurture that important part of ourselves. Yes, ma'am, Miss Baylor.
Yeah, I just wanted to say too, from a parenting aspect, I worked both the child and adolescent programs, and parents focus on behavior very much. And but behavior is an end result of how we think and how we feel about what we think to ourselves. And behavior is what is the result of those thoughts and feelings. And that's part of the cognitive behavioral model. And so when I get parents to back away from the behavior and say, well, what were you feeling before that happened? What were you thinking before that happened? We really get to the root issue. When we focus on behavior, we never know the root issue. We assume we know, and it causes a lot of misunderstanding. And then parents talk a lot about feeling disrespected because that's the behavior they see. And I always try to tell them disrespect and feeling heard are two sides of the same coin. So a child doesn't feel heard, so they up the ante in their behavior. And that makes them feel unheard. And then the parent hears disrespect and they try to punish that disrespect. And did that solve the problem with the child being heard?
Well, I feel like you've solved so many questions in just that quick statement. I almost wonder, do you have an infographic for that? Like, it would be so great to see that in a visual, but I think it would be so helpful for parents.
I have the CBT model in a visual that I can pull up. But as far as the parenting dynamic, no, I don't have that in a visual, but I can bring up the other.
I appreciate that. Ms. Baylor, let me ask you a question just on the heels of what you shared. You know, we have youth that are experiencing an incredible amount of change. And when you're an adolescent anyways, I mean, you're constantly experiencing change and that's hard enough to deal with. So in the quarantine COVID state that we live in, you're seeing kids who are at home, parents who are trying to adapt to homeschool. I know there is a lot of frustration on both sides. What should parents be looking for? What are some of the signs that they should tune into? And what recommendations would you have for parents as they're seeing some of these warning signs?
So we're seeing a lot of frustration. We're seeing a lot of focus on grades. We're seeing a lot of focus on, I have to get it right. I have to get it perfect. That's how it's showing up for kids and anxiety. And so they're having difficulty managing all that and not having the social avenues that they normally have accessible to them. Texting doesn't necessarily make us feel close to someone. Even talking to them on a cell phone isn't the same as watching their face and their expressions, and youth aren't the best at reading expressions. A lot of times they'll think you're mad and you're not mad, and their brain is developing. They're trying to figure all this stuff out, and there's less contact and there's less people to try out new skills and abilities on, and just feeling that sense of belonging. So I think there's a big drop in feeling connected, and that is the major task of youth, is to identify with a group and who they are becoming. And if they don't have any feedback, that kind of happens in a vacuum. That's where we're seeing a lot of stress with kids. It's like, if I don't have any support from my peers, if my family misunderstands what I'm saying and doing, and my teachers are telling me I still have to do the same amount of work with less interaction, we're seeing kids who are super stressed out. We've seen a rise in their level of anxiety in our kids, for sure. And so I keep trying to tell my teacher friends, see, we've been doing Zoom since March. We've had to, and we had like 3 business days to figure it out. And that's it. Glenn will attest. And so when we started Zoom 3 days later, the first night was terrible. And we just had to say, we have to change our expectations. And so that's what I try to tell my teacher friends who were getting ready to start school and had a lot of anxiety. I said, connect with the kids, lower expectations to connect with them, and have fun. They're not having fun. They're trying to teach the old standards. And I really wish more teachers would just say, you know what, I'm just going to work on connecting with them, because this is our only way to really help these kids through right now. Everything else will catch up eventually if they feel connected and cared for. So that would be my hope, is that with the different time demands and everything we have, is that families are taking the time to connect and figure out how their kids are thinking and feeling, and not focusing on their doing. Does that make sense?
Yeah, that makes a whole lot of sense. And I love, my biggest takeaway from what you shared there was we need to change our expectations and be okay with doing that. And I think that that applies equally to us as parents with students at home, but also just even for ourselves. We're all going through an unprecedented time and experience. And so it makes sense that we should adjust the expectations we have of ourselves and of others. And that perspective shift could make all the difference.
Yes, I agree.
So Ms. Baylor, do you want to just show us real quickly that what you've got on the screen here, this triangle makes so much sense and you make it so simple?
Yeah, so we usually start in our thoughts. We tell ourselves something. So is my mom or dad mad at me? What did I do wrong? Let's use a kid example, right? And so our feeling is like, I'm always in trouble. I never do anything right. So what would you expect the behavior to be then? If they never feel like they did anything right and they feel like they're already in trouble, would they act calm and peaceful and loving in that moment? They're not going to feel that. They can't regulate their emotions that great yet. Even at 15, 16, 17, they're still getting major functions of their brain online, incapable. And so, so often as adults, we look at kids as mini adults, but their brain is still coming on in phases. And they don't have the whole operating system up and running until they're somewhere between 21 and 25. They're not complete in how their brain operates. And so they're trying to make sense of things, and we're expecting them to act like adults, and they want the privileges and rights of adults, but they don't have everything on board yet. This is part of why kids are risk-seeking and things like that. Those systems aren't online and don't start becoming online till they're 15 to 17 or so. And if there's been trauma or difficult family situations, divorce, loss of a parent, things like that, it even delays the development of that child. So, even when I'm talking about adolescents, they're still children, and we sure let them know sometimes as parents that they're still children when we tell them, no, you can't do that, you're just a kid. But again, if our thoughts and feelings are negative, we're not going to act positively. And so we go through this model with families, we go through it with the kids. And if we can get them to challenge some of their thoughts, that they have become a habit and a behavior, if we can challenge their thoughts and say, wait, I'm going to ask, maybe they're not mad at me. Mom and Dad, are you mad at me? And they'll say, no, I'm not mad. I'm really focused on what I'm cooking for dinner because I made it wrong last time. Is that going to give your child a different feeling? And would their behavior change accordingly? Right? Yeah. And it can work in the adverse way. And what I show kids, especially suicidal kids, is I show them how their negative thought, they isolate, they're alone, nobody cares about me, I have to hurt myself, or I don't deserve to live. And then that gives them even worse thoughts, worse feelings, worse emotions. And once they realize that they have control and can back that up, because it can go this way too. Say, wait. When I cut myself, I feel worse. And I tell myself terrible things. So maybe my first thought, I have to challenge that first thought. Maybe I'm alone because I'm alone in my room. Maybe I need to go out and sit with my family. And if your family greets you and asks how you're doing, and they missed you today because you were in your room so much, is that going to give them a different feeling and behavior? And that it gives them that feeling of control over their circumstances, their situation, and their own thought life.
Thank you so much for sharing this, the simple visual depiction, because it actually touches on so many complex and dynamic things. And I feel so compelled after this webinar to write on a sticky note our thoughts, our behaviors, our feelings, and just to have it with me, right, for all of our interactions, right, whether it's with my daughter or with my colleagues or, on a project. Just having that simple perspective will help us understand sometimes people's intentions and position and perspective are not at all where we think that they are. Yeah. So we create these stressors, and those stressors then shape our feelings and our behaviors in sometimes negative ways.
And so next time your kid is disrespectful, you might ask them, I'm sorry, did I miss something? I feel like something's going on that I'm not aware of. Can we talk about that? How are you feeling right now? And what made you think that that was happening, because I didn't feel that way. And so it helps just back it up, slow it down, and allows for a new path to be made.
Again, that's great. So I'm looking at another question that's gonna kind of switch gears a little bit here. And I'm not sure which one of you will want to chime in. Dr. Hirschfeld, this may be a you question. We're hearing reports that there is an uptick in substance abuse that's relative to COVID-19 and quarantine. Is there any merit to that? And if so, what are you seeing and what should we know about this trend?
Yeah, I mean, there certainly has been a lot of evidence that drinking, especially alcohol, has gone up. And, I would assume, but I haven't necessarily seen any literature to support it, but I would assume that there are similar increases in other substances that are typically used to calm uncomfortable emotions and to escape things as well. And so, I mean, typically some of the warning signs are, other people getting concerned about your substance use and things of that nature, or it causing an issue with interpersonal functioning and things of that nature, because these tend to be, kind of bellwethers for other problematic behavior. Because a lot of times if we're, if a substance is going to interfere with our interactions with loved ones, it's probably going on a lot more behind the scenes. And it's probably, for just their physical health wise, it's probably a lot more detrimental. And it tends to spill over to a lot of other things. And there is a lot of evidence that substance use of realistically any substance or any addictive behavior does worsen mental health, depression, anxiety, and things like that, because we're turning to an exogenous substance or something outside of us to calm it down, which eventually we develop tolerance to when we need higher doses or higher amounts, and it just starts spiraling out of control.
That's incredibly helpful to hear. Again, you take a complex subject and you break it down very simply. I think that so frequently people reach to substance because they think it'll make it better. And essentially what you've said is by relying on those outside substances, we're actually worsening a lot of the root drivers. And that's important to know.
And one of the big reasons why we do turn to substances because they do make it better for short periods of time. Alcohol is certainly known to improve anxiety, but one of the issues is it's really hard to function while constantly being intoxicated. And it's also wreaking havoc on the liver, the brain. Pretty much all medical issues are exacerbated by chronic heavy alcohol use. So, it's part of the reason why it does get abused is because it does help in short bursts. And, most substances do that in short bursts. They are beneficial, but, there's a whole slew of other issues that tend to arise with substance use. And eventually it does become maladaptive and it's not beneficial in the long run.
Yes, Miss Baylor.
Sorry, I always think of the parent piece, right? How does this apply to parents? So what I would say is it also teaches your child or children a style of coping.
Yeah.
And a lot of our substance abusing youth have substance use parents. And so it teaches them, this is how you calm down, this is how you feel better, this is how you relax. And so I often tell parents, if that's what you've taught them about coping, is that effective for coping that you feel good about teaching your child? And it's like, oh, not so much, right? So it's looking at that model you're presenting in your own home as well.
So let me spin that into another question, because coping and coping skills are so important, and I don't think that we talk about them enough. I think that sometimes mental and behavioral health matters. I almost see them as a little bit of a slippery slope. Maybe someone is experiencing something for the first time. They may or may not recognize that they're struggling, or they might be afraid to recognize that they're struggling. Are there practical tools or tips that you would have to that people could do at home to just either be more self-aware and or to adopt a healthier coping mechanism?
I have some really simple ones, if everybody's okay with that. So one of the ones is if you're busy in your mind and your mind's overwhelming you with anxiety or negative thoughts, or you just feel out of control with what's happening in your brain. I always talk about it like a computer. It's your hard drive is just spinning, right? And you get in that moment. So there's a really easy tool. We call it 5, 4, 3, 2, 1, and it's grounding. And then you use your 5 senses to get out of your busy brain and get back in your body so you can calm yourself. So you name off 5 things you can see. So the computer, each person here, right? You would name them off. And then what are 4 things you can touch? I can touch my keyboard, I can touch my phone, I can touch my drink, I can touch my mouse. What are 3 things you can hear? I can hear talking, I can hear the traffic outside, and I can hear the air conditioning. What are 2 things I can smell right now? I can smell my lipstick, and I can also smell my water over here. And what is 1 thing I can taste? So sometimes you can just, even just a little bite to your lip, not harming yourself or damaging yourself or any way. A lot of people will just chew on their nail for a second. And it's just a way to get back in your body and outside of that really overwhelming experience in your head. The second tool, and there's a couple different ways to do this, but that was called grounding, and we call it 5, 4, 3, 2, 1. So it starts with the easiest to use sense, which is your sight, and it ends with the hardest to use sense in some settings, which is taste. The other ones are breathing. So anytime you can get more oxygen in to your body, the sooner your brain will calm down. So if you feel scared or afraid or worried, if you can get more oxygen in. So what I teach is 4-7-8 breathing. You take a breath in through your nose for 4 seconds. You hold it in your lungs for 7 seconds, and you release it slowly over 8 seconds with fish lips. Kind of. If you can do that 10 to 20 times, you will be so much calmer at the end, because your amygdala, which is a almond-shaped part of your brain that is your alarm bell in your brain, the quickest way to calm it down is through pure oxygen. So the more oxygen you can get in, the sooner you're going to calm down and relax.
Wow, you have changed so many days for so many people, I think, just in those practical steps. And I know that those are just the tip of the iceberg. I'm sure that as a group and as professionals, you have a whole treasure trove of resources and ideas and practical tools to use. We have a question that's come in that is important and albeit a little bit basic, but do you limit your services to people who live in any specific geographic area?
No, on the youth side, and then I'll let Lorraine dig in. No, we don't. With the wonderful technology of Zoom, we've had patients in Murrieta that have been serviced in Murrieta that live in Yucaipa and Calamasa area, and so it's really just based on where we have the available group and slots. One of the great things about the care we provide, it is specific, so we do limit our group sizes. So for the adolescent side, 7 to 9 patients is what we'll see in any one of those tracks. And so because it's limited, then we have the ability to move some patients around now technology-wise via Zoom. But then when we go back to live person, as long as they can come to our facilities, depending on where they are, we'll be able to work with you. Here in Redlands, we have a relationship with the Ronald McDonald House, and so we've had families all the way from Bakersville that have come in, from Lucerne Valley that have come and received services, all the way up to Sacramento. They've flown down and stayed and received services. So we don't limit the care that provide. If you can get to us so we can see you and work with you, then they'll be okay. In the Zoom world, you have to be within the state of California, so we won't see anyone in New York or Hawaii quite yet, but I'm working on that. But outside of that physical location, no, anywhere within Southern California and even Central California, we'll be able to help you, because there's a limit on. There's not a lot of child and adolescent services at this level in the state of California, and specifically in Southern California. We do see patients from far distances. And Lorraine, I cut you off, but I don't know if you want to add to that.
Yeah, I know Kaiser West Covina has referred to us, Kaiser Pasadena, all the way down through this area. And we also had a family fly in from Portland, Oregon. And
Wow.
they would just stay 3 days a week between the hotel and Ronald McDonald House. They would do that because there was nothing in their area, and there are very little services. So we do have a huge catchment area, because the next closest programs are Rady and UCLA, right? UCI has some services, but we seem to draw from a bigger area than them because we've been established a lot longer.
Well, and I think that's probably a testimony to the care and the treatment that you offer as well, to know that people will come from, far and wide. That really is a testimony to your treatment. So thank you. We've got just a few more minutes here, and I've got a couple more questions that are coming in. One of our participants asks about, clients or patients that might come in with chronic pain issues. Do you guys see a lot of association between mental and behavioral health treatments and chronic pain issues?
Yeah, sorry, I was trying to answer that one, but I clicked the wrong one. So I did type an answer, but I mean, frequently chronic pain is associated with a lot of issues in relation to depression and anxiety in and of itself. And so there is, the lines between those tend to be pretty blurry. So one of the issues specifically with a lot of the medications that are used to treat anxiety and chronic pain is they tend to be associated with pretty uncomfortable withdrawal or even dangerous withdrawal syndromes. So a lot of times we'll need to have patients sent to detoxification centers first, just to make sure that they are medically stable enough to come in for treatment, because of the addictive nature and the negative associations with mental health and the issues associated with memory consolidation. We do, have a no tolerance for substances like benzodiazepines and opiates while they're in program, because it is contraindicated and it's not going to be in the long run beneficial. But yes, we do treat chronic pain pretty frequently, and there are a lot of things that we can do aside from opiate medications and other medications that can be abused, and the same thing with anxiety medications as well. Fantastic
answer. Well, we're down to our last few minutes, so I want to take a moment to just recap for our audience that we will be sharing the video recording of this webinar to our website. We'll also be sending it out to some of our peers in the nonprofit world and just across different sectors where there might be value. You have been so kind as to respond to many of the questions that have come in with phone numbers and resources. So we will send out a recap email to everyone. I'm just reiterating those resources and highlighting some of the touch points here. With our last couple of minutes, I'd like to give you guys the floor, and maybe one by one, I'll just ask, what any closing comments that you have for the community. What do you want them to know about mental and behavioral health? Mr. Graves, maybe we'll start with you.
Well, first of all, thank you very much for inviting us. We're so happy to be a part of the community in the Temecula area. Dr. Hertzfeldt lives locally in that area, so he's a community psychiatrist. So we're just really proud to be there. I think that maybe the parting message I would like to leave is that we're here for you. If you need something, we're here for you. I saw Dr. Hertzfeldt and Lorraine both posted phone numbers. You can feel free to call if you just have a question. I take calls for questions all the time from community members. So again, just really happy to be here, happy to be part of this team. And Loma Linda is a very special place. Thank you.
Thank you. And Mr. Scott?
Yeah, no, there is hope. That's the biggest piece that I would say. It is not hopeless. You may feel hopeless, but there is hope, and we're here for you. Our website has lots of great information. LOUBMC.org is a great resource to find more information about what we talked today. But there is hope, and there are resources out there, so you don't have to struggle alone. So, and thank you so much for the time today.
Oh, it's been our pleasure. Dr. Hertzfeld, any parting words from you?
I mean, unfortunately, they've taken a lot of the words. I mean, you know, most mental illness is substantially treatable, and you know, with proper treatment and addressing it, sometimes for the first time, people are able to see the world in a different light. And so, you know, we do have a lot of resources for benefiting people who are undergoing an enormous amount of stress, especially in these chaotic times that we're currently undergoing. So, you know, it's also, you know, selfishly from our perspective, it's quite a gratifying experience to see someone have such a transformation in their life. So, you know, it's nice to be able to foster that as well. So it's I'm assuming near and dear to all of our heart, if I can speak for everybody.
Thank you for sharing that, because I think sometimes when you are experiencing a mental or behavioral health issue for the first time, or for the first time in a while, it doesn't always feel like there are a lot of solutions, right? Like we get in our own minds and we create that barrier that there just isn't going to be something to help me through this. But like you just so nicely said, we have so many resources, and just about everything can be helped. So thank you for that. And Ms. Baylor, last word to you.
I would say we are blessed to do the work we do. We get to see those amazing changes in families. And there's nothing like it. When you can see 6 to 8 to maybe 10 or 12 weeks, which is less than 1% of childhood, right? And we can see a family turn it around substantially, and the next generation doesn't have to carry the baggage of the previous generation. That things that were may have been untreated by your family of origin, or by your grandparents of origin, or just losses in your life, doesn't have to be passed down the way you received it. It can be so much better. And we get that opportunity to help you do that. And we are very skilled at what we do. I don't mind saying that at all. We love what we do. And that's the other thing. I think our approval rating comes from, we have staff who are really committed to your family and your well-being. And I'd also like to give a short plug for our MEND program of people with chronic medical conditions, children, adolescents, and adults, that is also available in the Redlands area. So there's a lot of mental health disorders that come along because of physical difficulties. So.
Well, thank you for wrapping that up. I want to just personally and on behalf of the Temecula Valley Chamber of Commerce, thank all of you for making the time today. Everything you shared was very impactful. And I can only echo some of the comments that I'm seeing come through chat and Q&A. There's just lots of appreciation for everything that you've shared. And we look forward to paying this forward and sharing it with our community. Thank you for what you do. And we appreciate your time.
You're welcome. Have a great day.
You too. Bye-bye, everybody.
Bye-bye.
Bye.